Okay, I'm Dr. Jason Mendoza. I'm Associate Professor of Pediatrics in the University of Washington School of Medicine and investigator in the Seattle Children's Research Institute. So I had the benefit of being trained as a pediatrician in the Department of Pediatrics. And so there were a lot of amazing role models throughout the department. And there weren't just role models, but there were people who were willing to talk with me when I was, still a trainee, let me know what they do, and kind of, encourage me to pursue the path that would eventually lead me to becoming faculty in the department. And so I was able to not just become a pediatrician, I was encouraged to seek training to become a researcher, and then I was, which I also was trained in the Department of Pediatrics for research. And then I was able to get my first faculty position elsewhere, where I did, I think I did pretty well there because of the training I received here. And then thankfully, the research enterprise here in the department and at Seattle Children's just really blossomed, and there was an opening in the in the department, and I was recruited back and came back in the last year and a half or so. And so it's really I don't know, full circle. Like, they trained me, they encouraged me to pursue research and to become a pediatrician and a researcher. And then through hard work and, well, I imagine a lot of serendipity, I was able to come back and join the faculty, and I'm absolutely thrilled to be here. Regarding the research we do on physical activity and improving diet, the reason we focus on children who are racial ethnic minorities or low income is that those kids and families are at higher risk for obesity and a number of chronic diseases such as high blood pressure, cardiovascular disease, diabetes, and so what we do is try and reduce those risks. And so we're taking the perspective of a health equity lens, a community health equity lens, because our interventions, like the walking school bus, the bicycle train program, they don't take place in the hospital. They take place out in people's everyday lives, out in the community, in the schools. And so we try and intervene there to, in some ways, or in many ways, keep them from having to come into the hospital in the first place, because we are healthiest out in the community. And so in that way, we are specifically trying to enroll kids who otherwise are overlooked for a lot of research studies and a lot of healthcare delivery.